All right, we're going to do taping for the erector spinaes, and this is a really great taping technique for general lower back pain. So it works an absolute treat. So depending on where they feel the lower back pain depends on where we actually decompress. Now the difference here is that we actually use 2 strips, okay, in terms of our stabilisation. So we'll have one that goes either side. So it's really important that we make sure that we've got our clients in the sitting position here, and obviously they're going to bend forward and we're going to go into forward flexion, okay. So the first one here, what we do, tear off the backing tape like so, okay. So we want it to go just below probably that L5 region, which is roughly around about here, okay. Just bend that down like so. Okay, got our decompression here, and we've got our other stabilisation. So both of these are going to go exactly at the same level. Okay, so back down through there, like so. So we've got a strip like that. Now we need to get our client just to bend forward, just as far as they can comfortably go, like so, without falling off the table. That's perfect, is. Okay, 30 or 40% stretch, which is about there, like so. Okay, pop it just under there. Same again with this one. So if you've got it at the right heights and so forth, it should be almost exactly the same, which we have. Perfect. Okay. Now the decompression goes over wherever they feel the pain. So if they're feeling it here or they're feeling it there, this is where we decompress. Okay, so this time we're using obviously the 50 centimetre, sorry, the 100 centimetre I should say. And we're going to go right across like so. So 80 or 90%. Okay. So towels off. Like so. Give it a good rub and you're done. So that will lift and offload wherever they have that lower back pain. It's absolutely fantastic in terms of dealing with that lower back pain. So if you've got pain at the thoracolumbar or more at L4, L5 area, this will work an absolute treat.